Welcome to the July Grapevine, and boy, do I have a special treat for you. This month, we have a guest star reading her own section, Catherine.
At BREMO, our mission is to help people reach the best possible health through excellent pharmacy care. One of the big ways that we try to accomplish this is through our clinical programs. For example, patients who take multiple medications may be eligible for an annual medication review or MTM, and that's paid for by their insurance company frequently. We also routinely monitor which of our patients are good candidates for vaccines and recommend them when appropriate. These extra steps take time and are the types of things that help BREMO stand apart as a pharmacy that provides a higher quality pharmacy service than your typical pharmacy. For years, it has been a goal for our clinical services to not only be a value-added service, but to be our primary source of revenue, and more so than product-based sales. And while we're not there yet, we have definitely seen tremendous growth in those areas, and we see no sign of those opportunities slowing down. In fact, we are excited to start the Test and Treat program this coming months, as well as vaccines for children this summer with the health department. So over the past year, we've also seen a lot of growth in the prescription sales at both the retail pharmacy and the long-term care pharmacy. And while this is good for business, the growth has happened so fast that it has sometimes been a challenge to keep all the work flow going and get everything done. I really appreciate the teamwork that has gone into ensuring that we continue to take great care of all of our patients. We do feel that between the growth of our prescription sales and the expected growth of our clinical programs, that it is time for us to add another full-time pharmacist to our team. I'm excited to let you know that Ashley Brooks will be joining us full-time. Ashley has been helping us out at the retail location for the past several months and has done a great job. She will begin with us full-time in August, and while Ashley will eventually learn both locations, she will keep her focus at the retail location until Regina returns from her maternity leave. When you see Ashley, please congratulate her on her new position, and we look forward to seeing her in August. Thank you.
Yes, welcome Ashley Brooks. We're so excited to have you here at BREMO, and thank you again to Catherine for being our special guest. On to announcements. Welcome to our newest relief driver, Megan Carey. Megan previously worked with our delivery team years ago and has just moved back to the area from Colorado. We are excited for her to continue her work here. Please keep safety in mind when driving through the parking lot. All employees need to be mindful of their speed and be sure to be looking around. Turning the corner to the back parking lot of long-term care can be a treacherous stretch, so please be observant of the speed limit. As the group reward for all locations exceeding their goals last quarter, BREMO will be taking us out to a Flying Squirrels game on Saturday, July 27th at 6:05 p.m. Starting at 5 p.m., we will be in the Segra picnic zone before the game for an all-you-can-eat buffet, which includes hamburgers, hot dogs, barbecue pulled pork, macaroni and cheese, coleslaw, pasta salad, and non-alcoholic drinks. And then we'll have field-level seats to the game. Each employee can bring one adult guest and children. Please use the form that's linked in the Grapevine to RSVP to the event by Friday, July 12th. Even if you are not able to respond, please go ahead and do fill out that RSVP form. A dress code reminder. BREMO t-shirts are only to be worn on Fridays and Saturdays. Please wear your other BREMO attire throughout the week. Dress pants or skirts are appropriate for work. Drivers may wear shorts as long as they are as dressy as dockers. Jeans and sweatpants are too casual for work. Did you know that you can access the calendar from home using the internet? Go to www.bremorx.com/webcalendar. You will need to enter a user ID and password. Those are available in the master password document at retail and LTC. Did you know that you can see how much vacation and sick leave you have in TimeClock Plus? Go to the TimeClock Plus screen and input your employee number. Then choose to log in. Once logged in, you can choose the View section. Under that, you will see accruals listed. By selecting that, it will show you both the amount of sick leave and the amount of vacation you have earned. Please be certain that you have enough time in your bank before requesting time off. Did you know that the vacation cutoff is always the third Monday of the month? Please be sure to submit your requests for vacation before that day. If you have a doctor's appointment, be sure to let your manager know as soon as you can. It can be after that date, but it should be submitted as early as possible. If anyone is interested in contributing to the newsletter, social media, or online content, please see Merity. We have updated our list of needs for the United Way brain boxes. Please review the Sign Up Genius and bring in items to help our fundraiser by August 9th. As a reminder, we are partnering with United Way to build educational and mentally stimulating boxes for 50 of our senior retail patients. The location that collects the most items will receive a free lunch. First, we'll be starting with Bremo. Retail is excited to have Dylan and Taylor with us this summer. They are doing a great job learning all things Bremo. We also got a new robot at the end of May. There have been a few hiccups and we hope to have smoother days ahead of us. We are also excited to announce that Letitia will be learning to compound and will serve as another backup when Carla is out. Having so many technicians who can compound is so beneficial as we continue to see this part of our business grow. We also have 2 technicians, Ashley and Amy, becoming certified to administer immunizations. We will be happy to have this extra help this fall when flu season starts. We are also excited to begin a new partnership with CCWA for Tech Class. These students are expected to start in August. The biggest effect that this will have on the pharmacies is when students start their rotations at each location. If anyone is interested in being an advisor, please let me know. Our clinical services continue to show growth, and there are new patients wanting to use Bremo every day. As our pharmacy continues to get busier and busier, I want to thank everyone for working so hard and always trying to take care of our patients. I appreciate everyone's efforts. LTC has done a wonderful job keeping up with the monthly cycles while adding on several new homes for July 1st. Awesome job to all the technicians and pharmacists. Everyone should be using Cash Plus for any claims that are not covered by insurance, both RX only and OTC claims. Cash Plus works similar to insurance. You have to process a claim to get the copay for the patient. This means you can no longer quote a price out of the prescription screen using preferred, OTC, cash, or generics uninsured. The only exceptions to this rule are prescriptions for nutritional supplements like Ensure, Boost, Jevity, Thicket, Simply Thick, etc. They should still go through nutritional supplement, as well as any product we keep in-house to repack for clients monthly. The repacks will go under a separate price plan named Repack. Again, this is only for monthly cycle repacks, not for new clients that bring in meds from another pharmacy. That process has not changed. Unfortunately, since Cash Plus is processed like an insurance, we are subject to paying transaction fees to submit and reverse claims. Currently, there is no way to quote a price of a medication without processing through Cash Plus. If Cash Plus gives a cost that does not make sense, for example, if the cost to the patient is less than our acquisition cost, we need to contact Cash Plus. Chances are the NDC for that product is not in their system or the GNC is incorrect in Prime Care. First, confirm the GNC is correct by comparing it to whatever is InsureCost or McKesson. Update and try to resubmit. If it comes back incorrect again, please send an email to our Cash Plus representative with the issue and CC Ashley. Their emails can be found in our LTC password manager. A couple of homes have requested that a date be present when a label is reprinted. For example, if there is an order change and you do not need to send the drug, only the label. Usually when a label is printed on a script that has not been filled, it will print with a date of 000000. To print with a date, 1, type in a last fill date on the prescription order screen. 2, hit save. 3, print a label. 4, go back into the prescription order screen and delete the last fill date. Use your clinical judgment on what the order date should be, either the date the order was changed or the date the order was written. If Ashley has given you a self-evaluation, please be sure to return it back to her as soon as possible. Lastly, the office. The new students for the pharmacy technician course through our partnership with CCWA will begin in August. Thank you to the advisors, simulation instructors, and tech class advisory team for all of your hard work. The office has been hard at work crushing their goals. Thank you to everyone who has been